My name is Hira Malik, and I will be talking to you a little bit about cardiac catheterization. Cardiac catheterization is a medical procedure used to diagnose and treat some heart conditions. This procedure will be done by your cardiologist in the hospital. To start off, your cardiologist will numb the area where the catheter will enter your blood vessel. This area is typically either your arm, groin, or neck. Then, a needle will be used to make a small hole in the blood vessel. What happens in this procedure is that a long, thin tube, also known as the catheter, is put into that blood vessel, again, in your arm, groin, or neck, and then it is threaded to your heart. Through the catheter, your doctor can do diagnostic tests and treatments on your heart. Sometimes, the cardiologist will use a special type of dye and put it in the tube. Your cardiologist will likely do this in this case as well. The dye will then flow to your heart. This will make it easier for your cardiologist to take x-ray pictures of your arteries, for the dye will make your coronary arteries visible in the pictures. The dye can also show whether there is a buildup in your coronary arteries. Buildup, or plaque, is a buildup of fat, cholesterol, and other substances. Buildup can block your arteries and restrict, and eventually, if left untreated, stop blood flow to your heart. If there is buildup in the arteries and is detected through this test, the disease is called coronary heart disease or coronary artery disease. A blockage can cause a decrease in the supply of blood and oxygen to the heart, and over time can lead to debilitating major heart complications, like a heart attack, for example. In terms of the procedure and side effects, this procedure rarely causes serious complications. While the likelihood of serious problems are slim, complications can include bleeding, infection, and pain at the catheter insertion site. Complications can also include damage to the blood vessels and an allergic reaction to the dye that is used during the coronary angiography. You should know that you will be awake during this procedure. You may feel soreness in the blood vessel where the catheter was inserted. During this procedure, you will be kept on your back and you will be relaxed because prior to the procedure, your cardiologist will give you a medication that helps relax you. This procedure typically takes from half hour to an hour. If a significant blockage is detected in your arteries of your heart that requires balloon angioplasty, with or without stent treatment, you may have this procedure at the same time as your cardiac catheterization. If a balloon angioplasty is needed, what happens is that a balloon can be pushed through the catheter and inflated to improve blood flow to your coronary arteries. A mesh tube, also known as a stent, may then be used to keep the dilated artery open for a long period of time. Stents are more of a permanent solution, as long as you, the patient, take care of yourself. It helps make sure that your arteries are open and that blockage does not occur. If the angioplasty is the solution, the procedure could take 2 to 3 hours. If the blockage is too difficult to access by angioplasty, or you have severe blockage in multiple major vessels, your cardiologist may recommend that you undergo coronary artery bypass graft surgery. This is the basic information that you would need to know prior to your cardiac catheterization procedure. Thank you.